the story is complicated in a lot of ways. On one end, we're dealing with institutional inequality that has persisted and existed well beyond this moment. And so issues of access to care, issues of underlying conditions, all of these things that something like a COVID pandemic kind of feast off of, exacerbates, helps and continues to drive those inequalities. But in addition to that, when you have that kind of systemic inequality going on, you also have a culture that's built around it, right? And over time, people feel that they can't trust government, feel that certain things that are being told to them aren't going to work in their favor because they have seen over and over again in many different things that it hasn't. And so, this combination of these things, the systemic problems, the economic inequality, all of those things, plus the belief that and the challenges in making sure that people have the information that they need, that they can trust the information that they are being given, and then follow through with the actions that are necessary, continue to drive, I think, some of the disparities that we still see.
The city put a lot of things in place to address the inequities, to get the message out, to improve the systems. But here we are, little has changed.
So I actually think a lot has changed, even though we continue to fight and have many similar issues.
But the bottom line is that the numbers are still alarming. Despite everything that the city has done, the numbers are still alarming.
So it is true that in terms of numbers, the numbers of people we are seeing die from this have gone down dramatically. Now, do the disparities still exist?
The disparities, yeah.
Yes. So I think a lot has changed in terms of what we know about COVID. We actually were able to drive down some of those disparities at different points during the pandemic. The challenge is that even despite some of those major gains, trust is still or distrust is still a huge problem. Misinformation is still being pushed out there about what works for COVID. And so you have to combat that. And so people are hearing different things. And a lot of what I hear from folks is that they're confused. They have a lot of questions. They want to be able to talk to health experts directly. And we know that access to healthcare experts still is a disparity, even though we've tried so many different things. And so, I agree the challenge is still in front of us. We've laid a lot of tracks that I think allow us to improve things, but there's no quick fix. So I think that one is that we can't forget all of the things that we have done have had major impacts. We have seen here in the city our efforts to follow data really impact the vaccine uptake. Chicago was one of the cities across the country that had the larger representation of Black and Latinx folks uptaking the vaccine. So there are things that we have done in the city that have worked. I think the biggest the biggest lesson learned for us is that we've got to continue listening. We have to continue to understand what's going on for folks now. Why is it that folks who remain unvaccinated? Why is it that, because one of the things that we see, and particularly in this Omicron surge, is that unvaccinated still drives a lot of the worst outcomes, death, severe hospitalization. And the challenge, I think, particularly when we're talking about the Black community, is we still see lower vaccine rates, despite vaccine being really available. You can get it at home. The city has a homebound program where folks can call and have the vaccine actually come to them. You can get it at pharmacies. You can schedule it pretty easily. But that distrust, and so that continues to mean we have to have conversations. That continue to means we need to educate.
I'm shaking my head, though, because you're talking about all the things you need to do. What is the plan? Mm-hmm. Is there a plan going forward?
Yeah, there's definitely a plan. There's a plan being led by our Department of Public Health. Now, I'll be honest, I'm not the person to sort of name the full plan. A lot of the work I did was squarely with the Racial Equity Rapid Response Team. I'm really proud that a lot of our partners there have now come up into our health equity zone system, which is led by folks at CDPH, and my partner Jenny Turner could talk a lot more about the structure of that. And a lot of them are actually now helping to lead the education on the ground, the outreach around vaccines. So the plan is to continue to drive those supports, and they are having a big impact. At the same time,
but you sound pretty frustrated.
I mean, I think we all are, right? I think this has been tough on all of us. I think for everyone to see the surge again happen, when we've made so much progress, both as a city and as a country, it's frustrating. But I think when you're working in it, you can't allow that frustration to stop you. You can't see a setback and allow it to be seen as a failure. You have to see that as a continued challenge because to your original point, there are lives at stake.
We talked to some community activists who've been working with the Rapid Team, and one of the things that I found interesting that they've said, they talked about how at some point they told us, as you mentioned here, that there's a distrust, there's a mistrust, and that there are a number of hurdles. And one of the hurdles that they talked about that they face was a lack of access to testing sites. Given, and people in the community not wanting strangers to come to their home to give them the vaccines, the city bureaucracy, the tape that it takes 2 weeks to get a vaccine pop-up event together, and then the community members don't want to pre-register and jump through all those hoops. So when they look at it, these are the hurdles that they're telling us about. And so my question to you is, I'm sure they have shared the concerns with you and other city leaders. Why have you not addressed their concerns about the mistrust and people coming to their homes, about the lack of testing facilities?
So we certainly have and are trying to meet some of those issues. So when you mentioned the lack of trust, people coming to the home that I don't know. So one of the efforts has been to, through the health equity zones, actually fund community-based organizations to do some of that outreach work. So folks who live in that community. Now that doesn't guarantee that they necessarily know them, but it does allow us to make sure that people feel that the folks coming to their door at least understand their community a bit more. Around the lack of access to testing, pop-ups, for example, is a strategy to have testing near and close to people, because the challenge is the underlying structure for testing in the healthcare system, is not something that we can fix overnight, right? And so the ability to work with churches, the ability to work with clinics to provide people closer access to their homes in a more nimble way.
What do you mean you can't fix it overnight? I mean, these are people who are asking to see more testing sites because it's needed. Why can't the city just provide more testing sites and eliminate all these long lines that we see? Why can't they be closer?
So we are creating more testing, but the demand is so high. So and so you have to balance the resources that you have, which we are spreading out, and we're driving them to some of the areas where we see the most need, right? Where we see the highest rates. We're working with federally qualified health centers to make sure that they have adequate resources to provide the testing. And testing is important, but what's really important to the overall issue is actually care. We have to make sure that it's not just a testing site that sits in absent.
And when you see the numbers as high as they are in the communities that we're talking about, the numbers, the percentages of blacks that are dying in Austin and Auburn Gresham and Inglewood and such. Your reaction to that?
It breaks my heart as someone who has seen the pandemic from this lens, from the city government lens, seeing across the city, seeing the data. As a Black woman personally, it breaks my heart. it breaks my heart to hear conversations where, despite so many different efforts that I personally have seen, folks that I care a lot about saying, no, thank you, I don't trust it. I'm not going to do it. I'll take my, I'll do X, Y, and Z. And knowing that the cost of that could be their lives is heartbreaking. And that's what continues to fuel me every day to try to find more opportunities, have different kinds of conversations, make resources available, and do whatever I can, even though I'm not a public health official, right? But bring whatever I can offer to this public health challenge. And I think I'm proud that I can do it in this moment. I'm proud that I have so many colleagues alongside of me that do it. But the challenge for all of us is very, very real.